Hello everyone, welcome to Let's Crack UPSC CSE English. About me, I am Sandeep Bhushan Thummala and my credentials are I have 8 years of teaching experience for civil services. I teach international relations, internal security and in-depth analysis of Hindu editorials and articles which will be very useful for the prelims as well as mains examinations. And this video is in regards to how to crack prelims and also mains 2020 and further even in regards to the next forthcoming exam in regards to UPSC 2021 also. And prior to that, you have a notification in regards to Let's Crack UPSC CSE English, which is India's largest learning platform. And once you get subscribed for the Let's Crack UPSC CSE English, you will have unlimited live and recorded courses from India's best educators. And these are the top educators at Unacademy, which you can see it on your screen. And the others are also which you can see it on the screen, the top educators at Unacademy. And these are the courses at Let's Crack UPSC CSE English, which are economy, history and also current affairs, and the rest you can also see it on your screen. And the other one is in regards to Let's Crack UPSC CSE English, the courses essay writing, practice and strategy, answer writing, and also in regards to interview preparation. So all these are the one which you can see it on the screen. And there is a note, and in regards to Let's Crack UPSC CS English, there is a subscription. You have a 12-month subscription and also 24-month subscription. 12-month subscription, the amount is 40,000, and 24-month subscription, the amount is 48,000. So it's always recommended to go ahead with subscription for 24 months, which the original price is 48,000. And you can use my code SBT10, that is Sandeep Bhushan Thummala, wherein if you use my code you will get 10% discount and the discounted amount would be 43,200. So it's always go ahead with subscribing for 24 months, because you will be effectively paying for only 13 months but you would get 24 months subscription. So you have the opportunity here, grab the opportunity by going ahead with subscribing for 24 months by paying only for the 13 months. So please do use my code. Do not forget to use my code, that is SBT10. While you are subscribing, you will get 10% discount. And now we will get into the topic, that is the in-depth analysis of editorials and articles of the Hindu newspaper. When I say the in-depth analysis, that definitely it is a comprehensive explanation which would be from my end as an explanation. Definitely it would be a comprehensive, it would be a better and a thorough understanding. So definitely I would focus on the thorough, better and comprehensive understanding or explanation from my side, that is in my lectures and my explanation, and it would be focusing on the editorials, articles and also in regards to any contemporary news which will be very useful for the prelims as well as mains examination. Because our focus will be, my focus will be in regards to factual and also in regards to analytical, which will be very useful for prelims as well as mains examination. So definitely my focus will be in regards to the factual, analytical and emphasizing on the keywords. These are the very important, because these are the one wherein you need to keep on focusing on while you are reading the editorials, articles or any news item. Your analysis or your emphasis has to be on the keywords and the key phrases, because this will help you a lot in regards to clearing prelims and mains and being at ease and also having more of enormous knowledge in regards to writing descriptive in regards to the mains point of view. So I will get into the topic. So today's topic is in regards to, so any guesses that you can make it? And I would say hi to Ram Kumar. Hi Ram Kumar. So I have taken this as a picture before we take up the class. So this is in regards to, definitely you can always go ahead with understanding that this is in regards to the migrant workers. So they are the migrant workers who are trying to reach their destiny, by walk. Definitely you can see the road as calm as it is, the way it is in the time of national lockdown. So definitely this is in regards to the migrant workers. So we will look at how or what we will focus. So we will be focusing in regards to the editorial. So safe return is the editorials, today's editorial. And then in regards to protecting the poor from becoming poorer, this is the article. So I have taken both today, making sure that I will explain the editorial and also the article also. The editorial which talks about the first editorial, that is about the safe returns. Pratham has joined. Very good morning, Pratham. And then today I'm taking up the class in regards to combining both the editorials and articles. Earlier I used to just focus on the article or editorial, but because there is a linking between the editorials and the article, that is why I focus on the taking up the editorial as well as the article. So editorial talks about Shreyas Jyoti has also joined, Jahnavi Saloni has also joined. A very good morning to you, both of you. So the editorial which talks about safe returns, yes, definitely safe return in regards to the migrant workers, and then the article which talks about the protecting the poor from becoming poorer, because we know in India, apart from what you said, the pandemic situation or the COVID-19 situation, we see the rich are getting richer and the poor are becoming or getting poorer. So that is the what the entire scenario is going on in regards to in India. But we will focus now in regards to how we will link the editorials and article, again focusing in regards to the migrant workers, focusing on the migrant workers, and also the migrants workers. It is a need of the hour for the government that they protect the poor. Not only just protecting the poor, but protect the poor so that they will not become poorer. This is very important for prelims, analytical, and also mains point of view. And Anvesh K. Mishra is also joined. Hi to you, Mishra. So my explanation would be on the safe returns on the migrant workers, and also focusing on the migrant workers, wherein it is a need of the hour to protect the poor and also make sure that the poor will not become more poorer. So what are the consequences involved in it, and why the poor would become poorer, on what is the effect of the national lockdown, what is the effect of the jobs, no jobs or employment is not there, or else no livelihood. So we will look at all those. Okay, we'll look at, I'll write here, the national lockdown. We will look at after the national lockdown, as no jobs, jobs have been cut. When the jobs have been cut, no income. When there are no incomes, then definitely what is that you do not have no livelihood, or else in regards to no economic activity. When there is no economic activity, definitely there is no, what do you say, a kind of economic activity is going on. When no economic activity, definitely it is a situation which is heading towards starvation. Please do understand, it is heading towards starvation. That is why the safe return is taken into consideration, today's editorial. And also we would be talking about when it is heading towards starvation, that means the poor are the vulnerable people who would be badly hit by because of the no livelihood or no economic activity, because of the national lockdown, no jobs, no income, no salary, and the end will be starvation, especially for the vulnerable or the poor people, wherein it is a need of the hour to make sure that they will not starve, the poor will not become poorer. So that is what we will be looking into. I will be looking into the entire scenario about the migrants, and also the need of the government to protect the poor and then make sure that the poor are not becoming poorer. Fine. So Chavan was saying, what can be the long-term plans of safety net provided by government? Yes, definitely. We will look at all the cases wherein what is the safety, extending the safety net, and then what could be the short term and what could be the long term. So this is very important when we are looking at the measures, how the government should protect the poor and then make sure that the poor are not becoming poorer. Further is short term programs or short term measures, and then long term measures. We will look at all this and make sure that it will be a very good session wherein we are today covering both the editorials and the articles together combined, which will be very very useful for you in regards to the analytical for prelims point of view, and also a very good answer you can write it in regards to the mains point of view, because what is important is protecting the poor from becoming poorer. This holds a lot of meaning, and it holds a lot of weightage also in the examination. Protecting the poor from becoming poorer. And definitely Pratham, what you are asking will definitely also I will look into it, and that comes at the last. Definitely I will look into it. And then Nikila is also joined. Hi Nikila. We are today, okay, for your benefit, today we are talking about, or we would be discussing about the safe return. This is an editorial, and this is the protecting the poor. This is an article. So we will combine both the editorial and then article, and then we'll come up with a very good answer. It could be analytical point of view answer and also factual, which will be useful for prelims as well as mains point of view also. So definitely you will be helpful by this. No role of fiscal deficit in safety returns. Yes, we will look at whether the government has to focus on the fiscal deficit now, whether the government has to make sure that there is more of money pumped into the hands of the individuals or the vulnerable sections, or the one who are the migrant laborers who have the Pradhan Mantri Jan Dhan accounts. Fine, we will look at, and at that time whether the government has to focus on the fiscal deficit or it has to just keep aside the fiscal deficit, wherein the fiscal deficit the government has pegged, or it has kept it to 3.2 to 3.5 percentage. What is fiscal deficit? Fiscal deficit means it is the expenditure what the government does. It is expenditure from the, what do you say, it is expenditure from the total revenue what we have. What is the expenditure we should do? So it is almost just close to 3.2 to 3.5 is what the fiscal deficit has to be as per the government. That is the expenditure from the entire GDP or the revenue what we have. So how we will try to focus that whether we are not exceeding the fiscal deficit, or else if there is a necessity that we have to exceed the fiscal deficit, then does it really we have to worry about the fiscal deficit, or we have to just worry about the money, or the poor should not become poorer, or else the poor has to be protected at this time, keeping aside the fiscal deficit concept. Now I'll get into the importance of bottom-up approach of Niti Aayog in current crisis. Yes, definitely. We will look at what are the measures and how best the government can make sure that the poor will be not becoming poor, at the same time trying to make sure that the migrant workers will be protected from the distress phase or distress condition what they are facing because of the national lockdown. And now first focus would be in regards to the migrant workers. So we know very well that because of the national lockdown, what the situation the country has experienced, because we wanted to make sure that the social distancing is maintained, because we wanted to make sure that we wanted to break the COVID-19 transmission, or break the COVID-19 virus transmission. So that was the need of the hour. That is why we went for national lockdown, emphasizing on the social distancing, further breaking the chain of the transmission of the COVID-19. So that has created a lot of impact on the migrant workers. So it is not only in India what we have gone ahead with the lockdown, but it was globally. The entire, what you say, all the countries have gone ahead with the lockdown. So there was not only the national lockdown, but we have experienced, the global lockdown. So because of the global lockdown, or what was the need for the global lockdown? Yes, the need was a hard decision, hard choice, but we were forced to take that global lockdown or national lockdown only to make sure that the spread of virus do not take place virulent, or to break the transmission of the COVID-19. So because of that there was a population lockdown, and because of the population lockdown, what was the next one which was associated with that was there was no economic activity. As I said, that because of the national lockdown, no economic activity. When no economic activity, that means there was no livelihoods. So definitely when there are no livelihoods, as I said, there was no, no jobs or no employment, or jobs have been lost. Employment and livelihoods on mass scale, that is globally, they were totally shattered. So because of the national lockdown, because of the population lockdown, there was a negative impact or a bad, the consequences was on, there was no livelihoods, the government could not provide the economic activity, thereby the employment was badly hit, there were no jobs, and that was the main reason economically, wherein all the countries globally have been impacted. And when we compare again with India, India has the largest number of people under lockdown. This is very important for analytical point of view. Analytical, there is nothing factual in it, but analytical. When you look into it, yes, definitely, as India is what is the second largest populated country in the world, and in regards to the COVID-19, if we keep aside the China, because China has been experienced the Wuhan, the COVID-19 before, almost what you say, close to 50-55 days before India has gone ahead with the national lockdown. So taking into consideration of that, India has the largest number of people under the lockdown anywhere comparing it to the world. So that is the what you say key word or key phrase, wherein we will keep on focusing on the national lockdown, which was taken at a very short period of time, and the population was locked down in India. So that means at a very short period of time, the government of India has gone ahead with taking a decision of the national lockdown. No doubt there was a what is a kind of a curtain raiser in regards to the national lockdown, that was in regards to the Janta curfew, and then after that immediately there was the government of India has come up with going ahead with national lockdown, as there was no other option, and the national lockdown was very necessary. It was imperative to make sure that we go ahead with the national lockdown, because if we haven't gone ahead with the national lockdown, the morbidity and the mortality rate in India would have been very high. As today we are talking about in South Asia or in India, comparing with the Europe and North America, or else even in South America or across the globe, if you look at South Asia and India, are comparatively the morbidity and the mortality rate are very less, because probably we have gone initially what you say with the national lockdown. No doubt it was a very good, but it was at a very short period of time the decision was taken in regards to national lockdown, and this, as we discussed, it has impacted the economic activity, and then it is ultimately the one who are economically vulnerable, that means who are economically vulnerable are the one who have been badly hit because of the national lockdown. I repeat, the one who are economically vulnerable, or we can take it into consideration the migrant workers or the vulnerable people. More than using the vulnerable people, I'm using economically vulnerable people. So this is a keyword again which is very important for you to focus while you're writing in the mains, so that you are not just writing vulnerable people. Your mention has to be because of the national lockdown, who were the one very badly hit because there was no, or there was total damage of economic activity or no livelihood. The one who was very hit, or who was the one at the receiving end, was the economically vulnerable people. So economically vulnerable people, or you can take it as economically vulnerable groups. So economically vulnerable groups are the one who were badly hit, and they were the one who were forced to sacrifice for others' better health. I repeat once again, those economically vulnerable people were the one who were forced to sacrifice. I'm using the word sacrifice disproportionately more for the better health of the society. This is very important point which you need to understand. When you understand, you will understand it. The entire what you say, the nutshell of the point of having this or using this key phrase, economically vulnerable group. So economically vulnerable group are forced to sacrifice. Are forced to sacrifice for whom? For the better health of society. For the better health of society. How? 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 Question mark. How? Okay, Pratham says that unskilled service sectors. Yes, definitely. Economically vulnerable groups are the one who are migrant workers, or again specifically who are not skilled. That means they are forced to work on various vulnerable situations because of the national lockdown. And again, once the economic activity comes into action, also it will be very tough for these economically vulnerable groups to find jobs. And if they find jobs also, they will not get the, or they might not be, I'm not saying they will not get, they might not get the income what they are supposed to get or what they have got before the national lockdown. Please do understand my point. the economically vulnerable group or the unskilled workers may not get the same amount or may not get the same amount of salary what they have got before the national lockdown. Fine, and these are the one who are sacrificing or sacrifice for the better health of the society. Why? Because this picture, this image speaks volume. This image speaks on volume about the economically vulnerable group are being forced to sacrifice disproportionately more for the better health of the society. Look at it. You have this all what you say economically vulnerable group, and look at no social distancing, no social distancing at all, and then they are trying to what you say get into the respective villages or states, and then making sure that the better health of the society is protected. So this is very important in regards to again the statement, which could be very important for the mains point of view. So probably now you are understanding how we are trying to get the entire discussion into a different scenario itself, different level itself, how we are going ahead with how the population lockdown or a national lockdown has impacted not only the what do you say migrant workers, but we have used the key phrase economically vulnerable groups. This is very important. Fine, and now we'll get into the next one. And what is important is the COVID-19 and its control measures will affect what all the control measures the government has taken, as we have discussed, the NLD or the social distancing. Fine, and then in regards to making sure that the manufacturing sectors or entire economic activity is no economic activity or no livelihoods. So all these measures, these are all measures. One, national lockdown or so maintaining social distancing, no economic activity, no livelihood, same. So all these are the control measures to control the COVID-19, but it will affect. Now what is important is these control measures to make sure that the spread of virus do not take place is very good, very important, and it is acceptable. It is acceptable, but it has had an adverse impact. It has had an adverse impact on health. This is very important, human capital and income of vulnerable population, and this will definitely what do you say impact, have its adverse impact on a short and long term basis onto the vulnerable population or vulnerable economic group. Okay, Jahnavi has written the lockdown has greatly impacted all those people also who are in need of urgent healthcare facilities like chemotherapy sessions, dialysis, etc. Yes, definitely. You are absolutely right, Jahnavi. You are absolutely right. And also, I would also look at the other side of it. We are just talking about what you say the when we are talking about human capital and income. What I have also emphasized is on the health. This health is also a point which I have mentioned here. So this is the one which are actually or what you say highlighted. Yes, definitely the one who need the healthcare facilities, the one who are what you say suffering from dialysis, or it could be from in regards to the sugar patient, diabetes, or in regards to again what you are talking about the healthcare, which is very important in regards to the chemotherapy or the dialysis, or in regards to again the kind of diagnosis which are really required for the diabetic patients. So all this, so definitely that is what I was saying, adversely affecting the health, human capital, and also income. And the Indian government, now we are slowly getting into the point, what is the need for the or what is the role of the government to make sure that they protect the migrant workers, that they make sure that the safe return of the migrant workers takes place, and also make sure that the poor are not becoming poorer. So the need of the hour is the entry or the importance of Indian government, and Indian government has told the Supreme Court, because it was raised, a petition was filed in the Supreme Court saying that the migrant workers who are being put in the quarantine camps, they are not being provided by giving a good facility, and then food and shelter is not provided. That was a petition which was filed in the month of March in the Supreme Court, and the government has given an explanation to the Supreme Court saying that the government is providing temporary shelters with food for migrant workers. So I have given you the entire what is the background, why the Supreme Court, why the Indian government is talking about it. As it has told or it has brought to the notice of the Supreme Court, because a petition was filed in the Supreme Court of the conditions of the migrant workers in the temporary shelters, or also even in the quarantine camps, because of their food and their the conditions in which they are living. So the government has made it very clear that they are providing temporary shelters and the food for migrant workers. And what is, even after a month, we have seen the government which has come up with a national lockdown, or else the government has given an explanation to the Supreme Court that they are taking care of the migrant workers. Even after that, or else we have seen that even after the global lockdown, India, to tackle pandemic, what is important is these migrant workers, they were traveling, or the efforts of the migrant workers have no signs of ending. That means we have seen right from the day one after the national lockdown, even today the migrant workers who are still wanting to get back to their villages or to their respective homes or to the families even now. And that is what the condition is, and that is what the focus we are making here. That when we are when we are focusing it, that is not that we are trying to find fault at the government. No, not at all we are trying to find the fault at the government. We are trying to emphasize or highlight the economically vulnerable group, what kind of situation they are facing, what is that they are going through the stages, or what kind of situation the economic vulnerable group or the migrant workers are facing or experiencing, not only at the time of national lockdown or just 1 or 2 days after national lockdown. No, even today, what is the situation? That is what our focus is, and that is why we were talking about the editorial of safe return, and then the poor not becoming poorer. It is the safe return of the migrant workers and the poor not becoming poorer. Is that what our focus and our entire discussion would be in regards to this? So it is very important that even after a month, the migrant workers, there is no sign of ending the pathetic situation what they are facing. And the one who have been badly hit because of the national lockdown is definitely none other than the migrant workers, or to be more specific, for the mains or prelims point of view, economically vulnerable group. Pratham Chavan says also chronic and psychological effect. Definitely, as we have discussed in regards to the COVID-19 and its impact on social behavior, human social behavior. Yes. And then leading to panic and loss of immunity. Yes. And reports have also suggested that thousands are going ahead with traveling the long distances, because they feel, as they have taken this image, yes, they are traveling on the foot, barefoot or foot, barely having little food and then water and shelter. They are traveling for thousands or else hundreds of kilometers, thousands of people, hundreds of kilometers, and then they are going on foot to escape the distress condition. This is what we were talking about, leading of chronic and psychological effect. Chavan, you were saying that chronic and psychological effect, that is nothing but the distress conditions to their families or to their families. So that means whatever the migrant workers are facing the distress condition, or else whatever the families at their home, because these people are not the family or head of the family or the group of family, one or two of the family are not present at the house, is also creating a distress condition. When we are talking of distress condition, it is on the social behavior. When we are talking on the social behavior, it is on the mental problem. There could be a mental problems, fine, and this could still further create in regards to fit of anger. It might create anger, and then also it might also create a kind of I'm saying suicidal attempts also. And then it will further create a new eccentric behavioral pattern. Eccentric in the sense a kind of a vague behavior. Eccentric is in the sense a surprise or a vague behavioral pattern. So look at the distress condition. When I'm talking about, I did talk about how it will impact the mental problem, the psychologically, and anger, and then also they would also get addicted to alcoholism, and then suicidal attempts, thoughts, and then eccentric behavioral pattern would come into their mindset. So that is the impact of national lockdown, especially on the economic vulnerable group or the migrant workers who are traveling, thousands of them traveling across one state to another state to reach their families. And some migrant workers have also lost their livelihoods because they have adopted places of work, or just because they wanted to go ahead with depending upon the social safety nets and their familiar support structure in their native places. And now because they wanted to the way they are going to their respective uh, states or villages shows very clearly that there would be loss of livelihood, and then there would be depending upon the social safety nets. This is very important, or better off, that is the conditions are bad depending upon the social safety nets and familiar support structure. So definitely their working conditions or their distress conditions will further escalate into a very bad situation, and then the functioning of the shelters, what the governments are talking about, that they are providing the shelters for the migrant workers across the state borders, and then they are trying to make sure that they go ahead with the thermal screening, and then they also go ahead with the providing them or putting them in the quarantine camps if they are having any kind of mild symptoms or symptomatic cases, and then make sure that they are in the quarantine camps provided with good hygiene food, and also in regards to the good hygienic condition also. So this is what is being taken up by the various states, that they will provide the shelters for the migrant workers. Now we will look at the pandemic and the poor. Leading to panic and loss of immunity, a lack of robust travel advisory policy and support for the governments. Yes, definitely there has to be a situation wherein all the governments, because when we are talking of the migrant workers, they are migrating from one state to another state. So it is a need of the hour for the government, state governments or the state government machineries, or else the secretary, or else the chief ministers have to come together and then work out a program or a policy or a better in regards to the system, how best they can make sure that the migrant workers reach their families or their respective villages or respective states is very important. And this, when we are linking the pandemic and the poor, as we have also discussed a little bit on this, the lockdown has helped. Definitely it has helped, but it has come as a huge humanitarian and a economic cost for the migrant workers or to the poor people. This is very important. Huge humanitarian and economic cost is the key phrase what is important for you to focus. National lockdown is at the cost of huge humanitarian and economic cost to the poor or vulnerable economic group. And this lockdown, as we have seen, it is because or amidst the economic crisis is more a moral dilemma. So the moral dilemma who are in the dilemma are the poor or the migrant workers, or the economically vulnerable group, or the one who are in the moral dilemma, that can be resolved only by the practical steps. Not just trying to keep them in the shelters will not really in the sense practically or rationally, it is not a kind of solution which will be resolved. But what is important is this compensating the poor or the workers of the unorganized sectors and protect the old and the sick is very important. So they have to come up with a very a policy wherein the states will come together and then work out a better the movement of the migrant workers from one state to another state, keeping in mind a policy, structured policy, wherein the policy will also have the kind of notion that they have to protect the migrant workers, making sure that they reach their destiny, at the same time making sure that social distancing is maintained, and also if there is a necessity they have to be put in the quarantine camps if they are having any kind of symptoms in regards to the COVID-19. And then keeping workers in the respective places is no longer viable. This is very important, because if you are thinking, I mean, if the state governments are thinking, and what if the state governments are thinking is right, that keeping the migrant workers in the quarantine camps or in the shelter homes, quarantine camps or the shelter homes is appropriate for longer period of time, is not a longer solution or longer viable solution for the center, because these migrant workers are not having any kind of livelihood. What are they? Are they are just in the center homes or they are in the quarantine? Fine, but there is no economic activity because they all depend on the daily wages or they are daily laborers. So they depend on the daily wage. So what is important is not just providing them putting them in the shelter homes and then providing them the food. It is livelihood is important. Fine, and putting them only in the work in the shelter homes is not a longer viable, and the center must work ways to allow transport to the native places. So what is the need of the hour? So definitely the government or the state governments and the central governments have definitely taken the initiative that the migrant workers have to be locked at the national highways itself, and then they have to put it in the shelter homes, or else if needed in the quarantine camps. Is not really viable or not really successful at this moment. What is important is they have to come up with the ways to allow them to move or to transport to their native places. That is very important. And then we have looked at the states which have also taken an initiative. Maharashtra, Madhya Pradesh and Uttar Pradesh has taken initiative that they would make sure that the migrant workers, because Uttar Pradesh has a lot of migrant workers who have been moved into various states, that is Delhi, it could be Maharashtra, it could be again in regards to the Punjab, Haryana also. Fine. And then you have again Maharashtra, which has many migrant workers coming from various other states. Uttar Pradesh, from Uttar Pradesh to various other states, and then in Maharashtra from various other states as migrant workers into Maharashtra. So likewise, you have it in the Madhya Pradesh. So these three states have come up with the policy or measures that they have to focus on the migrant workers, and then just keeping them in the shelter homes or the quarantine camps if required is not the a permanent solution or a long-term solution. What is important is these migrant workers have to be made sure that they would be reaching their native places. And at least Maharashtra has come up with this policy, making sure that once this second lockdown would end on March 3rd, the center has to plan to resume the railway services. So Maharashtra is asking the center to resume the railway services so that the laborers or the migrant workers would reach their respective states. Because of the national lockdown, what has been the situation of the condition that they are not able to move to their respective villages of the states. And even Madhya Pradesh and Uttar Pradesh are also gearing up to facilitate the return. We have seen Uttar Pradesh has taken that initiative, that the Uttar Pradesh government has sent various buses to different places, that is even Delhi also, that they bring back their students also, especially students and also migrant workers, that they would come back to the their state, that is Uttar Pradesh. So Uttar Pradesh government has come up with this an initiative, and then make sure that again when they enter into the state, they would be going through a quarantine facility, and they would be in the quarantine, and once only if there are symptomatic or asymptomatic cases, they would be in the quarantine camps, or else they would be returned back to their respective families. And this migrant travel is a safe way. By train, that provides for necessary physical distancing. So what the Maharashtra, Madhya Pradesh and Uttar Pradesh, especially Maharashtra, is asking the center to resume the railway services, because they feel that it is the safe mode of making sure that the workers or the migrant workers are traveling, and that is in regards to maintaining the physical distancing. Is that what the government also feels that? Pratham Chavan has said, what is the role of the Panchayat Raj, urban local bodies and in current crisis? That is what. So when we are talking about the center, definitely it is the states again which has to come into action. When we are talking about states, it is definitely the panchayats, or the when we are talking about this municipal commissioners or municipal commissions or municipal commission of respective city, municipal commissioner officer or municipal commission, and then panchayat raj or panchayat raj system should also come into existence, and then you have also even urban local bodies. So all this in collaboration, yeah, all this in collaboration will have a, what is a joint efforts, and then that would be again further forwarded under the states, that is under the chief minister or the, what is a, chief secretary, wherein he would be monitoring the commissioners, entire municipal commissioners or municipal areas, municipal commissioners, or else you have greater, what is a, greater municipal commissioners, and then panchayat raj, and then urban local bodies. All these together will have the coordinated effort, and that would be, what is a, handled again by the chief secretary, again taken up by the chief minister, and again all the chief minister or respective chief minister in regards to migrant workers which are moving has to be coordinated with the central government. So it is definitely a kind of coordinated effort by all the, what do you say, different levels, at different levels, the government at different levels, at different governments, the government machineries will definitely come into action to make sure that they are working together, they are working as a coordinated effort, as a single entity, to make sure that the migrant workers are reaching their respective states. And what is important is, now as we were talking about the article, now protecting the poor is important. So when we are talking about the protecting the poor, we were talking about the health here, we were talking about the health here, making sure that there will not be any kind of adverse effect onto the health, human capital, and income of vulnerable population. So health, human capital, and income of vulnerable population. So what is important that we need to take care of, or else the protection of the poor is in regards to making sure that the loss of livelihoods, or else in regards to their decrease in dietary intake. This is very important, because it is a poor people who have a very poor quality of diet, which is actually what taken up by the poor healthcare people, or else the poorer people are the one whose dietary or the quality of diet is very meager or mere, that they are the one who have to be protected. It is not only in regards to the economic slowdown what we are talking about, but along with the what is said, the poor conditions or the poorer has to be protected, not only in regards to the economic activity but also in regards to the dietary intake. Dietary intake also is very important, because again this is very important keyword. It is not only economic or what you said, downsizing or downtown or economic activity has to be protected, but also making sure that the dietary intake is also taken into consideration about the poor people, and not only in regards to the, what is a poor health people, especially focusing on the pregnant women, because this impacts a lot. It impacts a lot on the pregnant women and on the children at the time of the lockdown. What is important is we need to make sure that the not only the economic activity but also in regards to the dietary intake. When we are saying dietary intake, it impacts the pregnant women and then the children's also, wherein they require the required amount of diet at this time. That is the time when they are kids, the time when a woman is a pregnant woman or she is carrying. So definitely the effect of lockdown is also felt when we are talking about the poor. It is on the dietary intake, and then especially focusing dietary intake on the pregnant women and also in regards to the children's. Fine. And why we are talking about is the nutrition. Dietary intake is what is important is the nutrition. The nutrition is important. Not only nutrition, again medical health care is important. Not only nutrition, medical health care is important. Why we are talking about medical health care? Because at the time of pregnancy or a woman or mother is carrying, then definitely all the health services has to be, what do you say, provided to the mother or to the pregnant woman. That is very essential, because for example we have taken as tetanus immunization during pregnancy is very important. If that is not, what do you say, taken into consideration because of the, what is a national lockdown, and the poor people, especially in regards to the dietary intake and also in regards to the health services, because uh, yeah, Janavi was talking about the lockdown has greatly impacted all those people who also who are in need of the urgent healthcare facilities. Yes, when you are talking about urgent healthcare facilities like chemotherapy, dialysis, what is important is also the urgent healthcare system or facility wherein the pregnant women requires, because at the time of pregnancy what is important is the tetanus immunization is very important, which has to be administered to the pregnant women during the pregnancy, because if it is not administered then it impacts a lot, onto the it has a long term effects, that is especially on the future educational achievements of a children. Immunization, tetanus immunization during pregnancy, if it is not administered because of the national lockdown and because of the what you say, if you are not able to protect the poor during the national lockdown, please look at my emphasis, during the national lockdown, then definitely as an example what we have taken, the administering of tetanus immunization, if it is not what you say taken into consideration, or if it is missed, then it will impact the child on the future, or it will have a long term effect, that is on the future educational effects. And this poor nutrition during the pregnancy or during the early childhood, for example, many of them would be just what you say 6 months to 8 months kids, babies, during the time of what is the national lockdown when it has started. So which will also again, which will be associated with the increased infant and child mortality rate, because of again we are talking about dietary intake, again we are talking about proper nutrition. If proper nutrition to the poor people, please do understand, if the proper nutrition is not being administered to the mother, that is a pregnant woman, or also later on after post delivery, that is to the babies also, then it would have a direct impact on the increase of infant and child mortality, that is death cases are bound to take place. That is why the importance is to protect the poor, not only the migrant workers but also to protect the poor. When we are talking of the poor, we were talking about the pregnant women, children, not only that, again who are born, and again in regards to making sure that if they are not having the proper diet or nutrition, then the mortality rate of the infant and child mortality rate might also increase. And there is a very good what is a point which I have mentioned here, which is really important, because we have this midday meal program. And what was the need for the midday meal program to be taken up by the government? Yes, definitely first and foremost was in regards to making sure that the attendance of the student to the school should be increased first and foremost, and then next is the nutrition by the midday meal. First is the attendance, no doubt about it, and second one is, which as second one has become the primary one now. This second one, which was what you say later on only for the sake of what you say bringing the people or bringing the what you say the children to their schools, has now become the primary. Please do understand it, how we are linking, has become the primary. Why it has become the primary? Because at the time of national lockdown, if the national lockdown was not there, then the schools would have been providing to the children's, that is we are talking about the economically vulnerable group children's, or children's of economically vulnerable group, they will get what is a midday meals. And this midday meal definitely has, or it is a nutritious meal. Rather than midday meal, we can use it as nutritious meal for the school kids, school feeding program. And now because of the national lockdown, these children are deprived by the nutrition meal. So that is what we are linking, that, and these are the what you say keywords and the key phrases wherever I am emphasizing. These are very important while you are going ahead with the analytical prelims point of view and also in regards to mains point of view. So this national lockdown has also deprived the children in regards to the nutritious meal, not in regards to the midday meal, but I'm rephrased it as a nutritious meal, and that is very important. And almost it has been 32 or 33 days the national lockdown and it has taken, and then that means almost for a month the kids are not having this nutritious meal. The one who I'm talking about, the children of the economically vulnerable group people are not having the nutritious meal. And if it further extends, then what would be the condition, or else the kind of dietary intake for the poor dietary quality, poor health care consumption people. That is very important. Okay, Janavi also has written. Chauhan has said that low hygiene condition and sanitation since poor live in close quarters. Yes, definitely the slum people, the slum one, or the one who are very living in a very congested areas. So they are the one who will be badly hit because of the hygiene condition. Janavi also says that indices of malnutrition, child stunting, child wasting are high among poor people. Yes, yes, Pratham Chavan, can we say the case of study of 1980 Spanish flu relevant to India's crisis? Don't worry, Pratham. I will definitely make sure that my session will cover everything. Everything, when I say everything, everything what you had in your mind will be on the screen. Will be on the screen. I bet, and I am for you all. Definitely. And when we look at this, and now it has come, Pradham, it has come. When we are looking at the morbidity, that is infection and then the death rate, morbidity and mortality means infection and the death rates are definitely higher in the countries among the people which have the, what do you say, lower end of economic or income distribution. So that means wherever the countries or countries with low income group or low income, countries with low income, countries with low income will be the one wherein during the pandemic situation there we will have more of what is a morbidity, that is infection, and then mortality means death cases. So you take it for granted across the globe, across the countries, across the world, whenever this pandemic situation arises, so definitely it is the countries with low income will be the one which will be, what do you say, badly hit in regards to the morbidity and then mortality. Fine. And now we will focus in regards to the what Pratham was actually having in his mind, that is the Spanish flu. Now we have taken the point in regards to what Spanish flu, the Spanish flu has attacked in the year 1918. Fine. And then it has impacted, or the death cases was almost close to 50 to 100 million people dead across the world. Fine. And poorer countries, now we'll focus in regards to India. India was also been, what do you say, affected by the Spanish flu, and then close to around 18 million people lives were, what do you say, where mortality rate has been, and then the percentage was 6% of the population was succumbed to the Spanish flu. 6% of the Indian population were succumbed to the Spanish flu. That means the country which is with the low income, the country with the low income, that is India, during when we are taking an example of Spanish flu, that is in 1918, it has impacted India, and it has impacted India, that is 6% of its population has been succumbed to the Spanish flu. That means our focus is in regards to the countries with low income. Countries with low income, when I'm talking about, or low income distribution is again a key word. Please do understand. Countries with low income distribution is again a keyword or the key phrase which I'm emphasizing. And now we will look at another keyword which is in regards to the social inequities, not inequalities, social inequities. So see, this social inequities are shown. Generally, you have, what you say, more of high mortality rate, as we were talking about in regards to Spanish flu, comparing it with India. Now comparing the COVID-19 with, what do you say, the social inequities wherein they are prevailing in US, where they are prevailing in US. So if you look at the mortality rate and then the morbidity or the mortality rates are very high in the minority groups, wherein even in US, not just we were talking about the countries with low income distribution, not only we were talking about the countries with low income distribution, but we are also focusing that we are focused in regards to the Spanish flu. Now we will look at in regards to the COVID-19. So if you look at COVID-19, definitely the minorities are the one who are living in a very dilapidated condition, or in a state of unhygienic conditions are the one wherein the more mortality rate will be. And here when we are talking about US in regards to the COVID-19, the minority groups or else the blacks are the one which were very badly. And then when we are talking about Spanish flu, we were talking about the countries with low income distribution. Countries with low income distribution across the nation, that there is no low income distribution, or else income distribution is not what is say equal. Fine. So in regards to that, we were talking about the keyword, that is social inequities. So social inequities, why are social inequities? They are because economically vulnerable people have poor nutrition and lower immunity. This social inequities is only because of the outcome of the economically vulnerable group. Social inequities are is because of the outcome of the economic vulnerable groups, and these economic vulnerable groups are the one who have very poor nutrition. They have what you say, they have the reach to poor nutrition, and once they are having the poor nutrition, definitely their immunity is low. Their immunity is low. So when their immunity is low, definitely death cases are high. Definitely the death cases or the mortality rate is high. So that is what the social inequities is there. So we have looked at various keywords and key phrases which I am trying to link it with what you say, one issue to the another issue. We have gone back to Spanish flu 1918, comparing it with India, which India, when we are talking about in regards to the countries with having lower income distribution, and also we were talking about the social inequities, comparing it with the US, wherein the minorities of the US in regards to again COVID-19. Fine. Again in regards to the social inequities, who are in regards to the economically vulnerable group, who are again in regards to having poor, they have the reach to the poor nutrition, and then because of the poor nutrition they have the lower immunity system. When they have the lower immunity system, they are infected very fast. When they are infected very fast, again to recoup it will be very difficult because of the low immunity, low antibodies count. When there is low immunity, low antibody count, then you are succumb to the infection, or you will be having a more death cases. So this is what I have taken in regards to the economically vulnerable group, or with the what do you say, poor nutrition, or else in regards to the with the one who have lower immunity system. So look at the way we are going ahead with each and every stepwise explanation. And this economically vulnerable group or people are the one who are in the crowded spaces, as Pratham was talking about. Yes, Pratham was talking about low hygienic condition and sanitation, since poor people live in close quarters. So that is what have taken this picture. And then Shiva Shankar has also joined. I would say hi to Shiva Shankar also. Before I take up his point, before I take up your point, so please tell your Telegram ID, sir. Okay, Telegram ID is in regards to the Let's Crack UPSC CSE English. Let's Crack UPSC CSE English. Shiva Shankar. Fine. So again, in regards to the economically vulnerable, sorry, I have keyed in hat. It is hi to Shiv Shankar also. So Pratham Chavan says, what was the role of Fit India in what was the role of it in India in current crisis? I didn't get it, Pratham. Please put forward your point once again. What was the role of Fit? I didn't get it. It or Fit in India in current crisis. Please try to key in once again. So economically vulnerable people are the one who live in the crowded spaces. So this is very important. Crowded spaces, as you are talking about the one who do not have what is a proper hygienic, or they live in a very close quarters. Fit India scheme. Okay. And making it, and the one who are what you say living in a close quarters. So definitely the disease, especially in regards to COVID-19 or SARS-CoV-2, will spread very violent, and then they have this inadequate access to safe water, sanitation and quality healthcare. That is what is important when we are talking about what you say 20 seconds of you need to wash your hands. Wash your hands for minimum 20 seconds. So what is important is the one who are living the economically vulnerable group, when they do not have water even for the drinking. So how can we expect that they will go ahead with washing their hands with soap for 20 seconds is a big question mark, and that is what they will be succumbed to the infections and further to the death or to the mortality. That is what the poor should not become poorer is what the article talks about. The economically vulnerable people are the one who are inadequate access. They do not have access to, or they have very limited access to safe water, sanitation and quality health. So I can take it this example as one of the Dharavi. Dharavi is in which place? Which is Asia's biggest, largest slum in India, Dharavi. And not only that's economically vulnerable group people, but also the one who are unable to work because of this COVID-19, the one who are actually into the informal sector or the unorganized sectors, or the informal sectors who are unable to work because of the COVID-19 or because of the national lockdown. They have lost their income. That is very important. And when they have lost their income, definitely they are in the financial loss. And when they are in the financial loss, what is very important is Mumbai. Okay, yes, Mumbai. It is in Mumbai. Dharavi is in Mumbai. It is Asia's largest slum. And this, what will make sure this, the death of and if the one who are in the crowded cases, and when they have this inadequate access to the safe water, sanitation and quality health, so there is a probability of what you said death cases becoming high, very high. And if the head of the family or the earning family is what you say succumbed or he has died, then the entire family will be in the financial losses, and then they will be living on the margins of the economy, and they would be later on being exploited by various other groups. So that is what is very important. And then there are various studies also in regards to the there are various Mumbai, yes. There are various studies in regards to population also, that poor nutrition in utero in the sense before birth, that is, as I was talking about, during pregnancy also, the mother when carrying the pregnancy, during pregnancy also, it is very important that the nutrition has to be what you say provided, not only during pregnancy but also for the childhood, that is even once they are born, that is from 6 to 12 months or 6 to 18 months, or else 0 to 18 months. If you look at, definitely the nutrition has to be provided, and this is very important. Otherwise what will happen is it will impact the reasoning ability and the educational achievement and income of adults. These are very important. The first one, if the nutrition is not taken into consideration because of the national lockdown, if the nutrition is not being provided to the pregnant woman or the mother who is carrying and the woman who is carrying, then it would affect the child, that is in regards to the cognitive, that is reasoning ability, and to the child in regards to the future educational achievement, and also in the future as an adult in the income also it will affect. How we will look at. So in regards to there is a long-term efforts in utero influenza exposure in the post 1940 US population. So there was a study which was taken up by what you say Douglas Almond in regards to in utero influenza exposure, in utero influenza exposure or utero influenza exposure in the post 1940s, that what the study or long-term efforts, what they have gone ahead with the report is that the children's born to the infected mothers, please do understand, we are linking it with that the need of the hour for the government to make sure that, or to protect the poor from becoming poorer, to protect the poor from becoming poorer is what we are trying to what is a compare across the world what it has happened to the one who had what you say a little or the nutritious food for the mother who is carrying, or the pregnant woman and the children, how it will impact the child when they are what you say reasoning ability or the educational advancement, or else in regards to when the child becomes an adult, and how it impacts the income itself, income of that particular person itself. So we have looked at what is comparing it with the 1940 post 1940 US population, fine, and the children born to infected mothers are definitely 15% less to graduate, that is in regards to education, and in regards to the men, their wages will be 5 to 9% lower than the one who are lower than the others, because they are born to an infected mother. Fine. And the disability rate will be 20% higher than the one who have been born with their, what you say, their buddies or their friends who are not affected by the flu. Here important is by the influenza, flu, and this is also one kind of influenza only. SARS is also influenza, because it affects the respiratory, and it is a respiratory disease. SARS-CoV-2 is a respiratory disease. So we have looked at the long-term efforts which have been taken up by the report by the in utero influenza exposure in the post 1940. So definitely these statistics is not really important, but it will be important for analytical point of view when you are writing an answer. How the national lockdown, that is nutrition, if it is not been provided to the mothers, that is a pregnant woman, and then the child or the kids at the right time, because of the national lockdown, to the poorer people, poorer, what is a woman who is carrying, or the pregnant woman, and then the kids or the children will be affecting them for the rest of the life. We are not just talking about short term, we are talking about long term. Please do understand this keyword, long term, as what is a Pratham was asking. So what are the measures for the long term? So this is what it is important, how it will impact the long term of the individual's cognitive ability, educational achievement, and also the income achievements when he or she becomes an adult. And then there is another survey which is in regards to the Center for Monitoring Indian Economy. That is, again, it indicates 44% of the households currently are the loss in income, wherein in the month of March it was 10%, as per the report of Center for Monitoring Indian Economy. This is again very important for prelims, and you can also mention in the mains a line, as per the Center for Monitoring Indian Economy survey, which has indicated that 44% of household report were having loss of income in the month of April, but compared to in the month of March it was 10%. So this point you can mention it in the mains descriptive answer. And there was another survey which was taken up, that is a telephonic survey by the National Council of Applied Economic Research. So this is again for the prelims point of view. So all these surveys are very, very important. So National Council of Applied Economic Research in Delhi has gone ahead with 84% of respondents have lost their income, and 30% have lost their food, fuel, and medicine. This is, experiencing the shortage in regards to the food, fuel, and then medicine. This is very important because it will further lead to starvation. It will further lead to starvation. That is what our entire, the motto was, the protecting the poor from becoming poorer. First, loss of income. Next, essential provisions also they will not be in a position to acquire or have with them. So that is what is important. So look at the surveys which were taken. I haven't gone ahead with just taking an example here and there. No, my lecture or our discussion is in regards to making sure that it will impact when you are writing or taking these surveys and then making a point in your in the mains, or else there could be a question given in the prelims analytical based on the survey. So what are the safety measures? Now Pradham was asking so the central and the state government have promised for free and subsidized food for low wage households, that is the one who are for the direct cash transfer, that is in regards to the below poverty line, wherein they will have this all the essential commodities, fine, that is food grains or pulses through the PDS system. It will be given to the BPL, fine, and that is in regards to the essential commodities. Food grains, essential commodities would be given. and also at the same time making sure that there would be some kind of money which will also be provided to the vulnerable people or the migrant workers, because they have lost the income, and then money is also very important, and it will be deposited through the Pradhan Mantri Jan Dhan account holders, to the Jan Dhan account holders. So this again, so looking at it, yes, it is very important that they have to focus in regards to the vulnerable sections, fine, and also the senior citizens, and also to the farmers, and also to the rural workers, and also to the construction workers, and last but not the least, the widows. So this is what the long term approach has to make sure that the government has to focus on all these people, that is they would be considered under the below poverty line. If they are not considered, also making sure that the senior citizens, farmers, rural workers at this time, at this situation, they should be taken into consideration, and then they have to just not go ahead with the short term, but they have to go ahead with the taking the current relief measures for a longer period of time, which will be for the long term approach or long term measure, which would be a long term approach or for a long term measure. So whatever is being taken into consideration has to be extended further for a more longer period of time, could be probably for a couple of months, or it could be a couple of quarters, and then a year or so. So definitely the measures or the extended measures have to be taken into consideration. And then the recent government, now we'll conclude this, but the recent government action in this direction. So definitely government is taking various steps or various measures to make sure that as per the situation, it is going ahead with amending its decisions, it is amending its strategies to make sure that maximum the daily wages or the vulnerable section or the below poverty line will be protected. So each and every time the situation is addressed, it is evaluated, and then the measures have been, other actions have been taken up in a new fashion, in a new kind. So definitely the government action in these directions are helpful, definitely helpful, but they are focused on short term. That is what Pradhan was talking, and what we have also looked at. It has to be for a longer period of time, it has to be extended, and governments need to take long term review or view, mitigating the economic and human capital effects. So just not looking at the lives, but also looking at the livelihoods is also important. When we are talking of livelihoods, it is in regards to the focusing on economic activity. When we are saying focusing on economic activity, what is that? What you say? It is providing jobs. It is providing jobs or employment. When the jobs are provided, income is created, or they have the income or salaries are created. So definitely it would be a long term approach. So we have looked at the safety return, we have looked at the safe returns of the migrant workers, and then the various means and measures how the poor has to be looked at. When we have looked at the migrant workers, and also in regards to the pregnant women, children's, the nutrition intake, and also we looked at the children's in regards to the midday meals. When schools are closed, how it will impact the poor people, and then how the government has to focus on the vulnerable section in trying to provide the food grains or the pulses through the PDS system. And then we have also focused on the economic vulnerable group, and all this we have looked at, making sure that it is the editorial plus article we have taken into consideration, and then we have come up with a new entity, and that new entity is nothing but my entire explanation. And this, I am saying it will be definitely useful for your prelims analytical, and also for the mains descriptive. I'm making it very clear, it will be definitely, because we have taken into few reports also, surveys also, because these are the one which you need to mention while you are writing in the descriptive reports and survey. This adds value to your answer. It adds value to your answer. What can be your future budgeting allocation? Okay. In regards to the fiscal deficit, I would say definitely no need to worry about the fiscal deficit. No need to worry. What is important is now going ahead with the pumping of money. Pumping of money. Pumping of money is very important, because if there is more of money later on, the RBI and the what is the finance minister can squeeze the liquidity, squeeze the excess of liquidity if it is more, or they can also go ahead with various measures like repo rate, reverse repo rate, or cash reserves ratio. By these methods the RBI can squeeze the liquidity and then handle the or control the inflation. But what is important is now protecting the lives are important, and for that, what do you say, the money is important. Required amount of money is very important at this time. Nothing to worry at this moment. Poverty elevation. Okay, if you what can be future budgetary allocation? Definitely, the government has to learn from the government of the day, or government has to learn from this what do you say COVID-19 pandemic, that the budgetary allocation has to definitely be changed. What kind of changes have to take place in regards to the budgetary, especially focusing on the poverty alleviation? So that means more of welfare schemes have to be taken into consideration, and when we are talking about more of welfare schemes, definitely they are the one which are creating more of economic activity. Schemes related to economic activity has to be taken into consideration in the budget. In the budget allocation, the government has to go ahead with various schemes. Those schemes which provides livelihood, I'm saying, please do understand, those schemes which provides livelihood. It is not that just what you say schemes in regards to talking about you will get that food grains and pulses. No, the other side of it is providing livelihoods or economic activity is very important, because money should also be with the hands, in the hands of the people. Along with the food grains, money also should be in the hands of the people, or with the people, with the citizen, with the especially with the migrant workers or the laborers. That is very important. And we also looked at what you say Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. This is also very very important, wherein the government has to focus in toto, implement it further. How can intra-ministry approach help in? Yes, definitely. Now, definitely we know that it is what you say all the ministries. It is all coordinated effort. Now it is all coordinated effort, not only coordinated effort between the what you say within the cabinet ministers at the center, but we have the coordinated effort, not only the cabinet ministers at the centers, but also the what you say state chief ministers. All the state chief ministers are also having coordination with the what is the center, that is the prime minister, definitely. And in regards to the allocation of budget in regards to the health, this is very important. Right now it is less than 1% to the GDP, less than 1% of the GDP. It is less than, this is less than. What is important is the prime minister has promised that by 2025 he will come back to, or he will increase to 2.5%. Even that will not be sufficient. What is important is at least 5 to 7%, looking into the or learning the lessons from the COVID-19. 5 to 7% of GDP allocation has to be to the health system or health infrastructure, and that is very very important in regards to budget allocation. In the lessons what we have learned from the COVID-19, as per what you say Pratham, what he was asking, what can be our future budget allocation? As I said, how can intra-minister approach help in current crisis? Definitely they are going ahead with what you say having a coordinated effort, trying to have the discussions, video conferencing with various chief ministers of the states, and also making sure that all the ministers at the center have a coordinated effort to make sure that they have more of money, and then how best they can try to avoid the spread of the COVID-19 or the infection. Definitely it is in a coordinated effort. And then Fit India scheme is improving condition of pregnant women. That is what in regards to, as I was talking about the in utero program. When I was talking about the in utero program, definitely it is in regards to that. That is why I have taken this one, in utero influence. Utero in the sense during the birth, I mean when pregnancy time. So I have taken this and also focused on the midday meal, and also focused on the midday meal also. So that is also what you say impacts a lot. Poor nutrition, this I was talking about, poor nutrition, midday meals. Fine. We need to be self-reliant in healthcare sector. We will be self-reliant in the healthcare sector only when there is what is a good amount of budgetary allocation being made to the health system, national health mission. When we focus on the national health mission, then definitely we will have a better, what do you say, the self-reliant in the healthcare sector itself. So I personally feel that covered all the, what do you say, necessary points from the safe return and also protecting the poor, looking to the migrant workers, and then how it can be taken into consideration, the way the migrant workers are actually facing the problems, and also in regards to the states trying to help the migrant workers move from one state to another state, and then protecting the poor, and then looking into the morbidity mortality rate, the way they have the poor nutrition, and then they are vulnerable, looking at the, what do you say, closed circuit, their livings, that is also impacts, and how the CMI, that is the Center for Monitoring Indian Economy, has gone ahead with survey, and also another one in regards to the National Council of Applied Economic Research. So all these have been, what do you say, I think it was very important, knowledgeable and informative to you all. So go make sure that you like uh, the the video, subscribe the video, and then hit the bell button for the further notification which when you're watching the Let's Crack UPSC CSE English in the YouTube channel. And then if you haven't subscribed for the Let's Crack UPSC CSE English, please do subscribe using my code SBT10, that is Sandeep Bhushan Thummala, wherein you will get 10% discount, and go ahead with subscription for the 24 months, because for 24 months subscription you will be effectively paying only for the 13 months amount. The amount you will be paying for 13 months, but you will get the subscription for the 24 months. And if you haven't subscribed, please do, what do you say, subscribe using my code SBT10, and please also inform your friends about the opportunity what you have for only paying for 13 months but getting the subscription for 24 months. And then the one who haven't downloaded the Unacademy Learners app, who haven't downloaded the Unacademy Learners app, download Unacademy Learners app, and then go ahead with downloading, and then you can also download, and then you can also view or be part of the Unacademy special classes. So you take the benefit of this also. Download the Unacademy app and then be part of the Unacademy special classes. And then thank you very much. See you tomorrow at 11 o'clock.